my beautiful butterflies. Good evening, good evening. Y'all come on in. Come on in. Let's talk about it. Y'all saw the topic. Another epidemic on the rise. Yeah, come on in. Come on in. Let's chat about it for a little while. On this phone, so let me turn it down. Got it. How's y'all's day been? I've been handling my business today, baby. Yeah, taking care of life's challenges. My own. Give y'all a few minutes to come on in the building, and we'll talk about it. In the meantime, y'all get your beverages while y'all coming in. I am drinking infused strawberry basil tonight. I'm going to put my glasses on. I'm going to tell you what else is in there. No alcohol. Ain't in the mood for alcohol. Real alcoholics, they have to have it. I told you, I'm a social drinker. Drink when I want to. And I'm at that age where I could be if I wanted to. I ain't got nothing else to do. I could be falling down drunk every day if I wanted to. As long as I got the money to buy it and I ain't asking you for nothing. Okay? But I don't have to have it. It's not necessary. Infused water, strawberry basil with other natural flavorings. Supposed to have a little sweet, light taste. It's only 10 calories. I got it from downstairs. And I guess this is a 6-ounce cup, I suppose. I guess. No, that's 10 ounces. There it is. It says 10 ounces. 10 ounces. Okay, let's take a sip while I'm waiting on y'all. It's okay. It's not sweet at all. So, I see y'all coming. I see 12 of y'all that entered. Y'all will be in a few minutes. But in the meantime, I like to get started. This evening, I want to talk about some health challenges that are on the rise. Hey, Miss Misty, you're here listening? Okay. While I'm waiting on the other ones, it's getting dark in here, so let me turn the light on while I'm waiting on everybody else to get in. Because by the time I end this live, it'll be too dark in the room. I have to step over the car because I got my light on. So I don't know if any of y'all even keep up with things that are going on in the world that affect all of us. I know some of y'all do. And I know Carolyn is in the healthcare profession, and it might be a couple of more over here that are in the healthcare field. But it doesn't matter what field you in. This can affect each and every one of us. We're going to be talking about health challenges this afternoon. And I like to tackle the hard subjects or topics that affect everybody. This was one I came up with. No subscriber asked me to do this. This is something I did on my own. I saw the article and I thought, man, that's an interesting article to talk about, because I know nobody in this sector has even challenged it. So that's easy. Okay. What's affecting America and probably the entire world? Let's talk about it. Something that had disappeared off the scene basically since the 50s is back in full force. Syphilis cases continue to rise as the U.S. faces an STI epidemic. Now, we just got out of the C-19, and I really don't think that mentally we can handle another pandemic that could go on longer than the C-19 epidemic went on. I just don't think in my mind that we could do that. And I don't know how they would do that because of the type of epidemic it is. It's not like where you can put a mask on this time. It's not like where they have an inoculation that you can go get and then get the booster and then get the other one and the other one. And much like the C-19, this has been here before and it's back again. Seeing more patients with more severe symptoms caused by sexually transmitted infections, syphilis. Having such problems this time around with a lot of vision problems and hearing loss. These symptoms are becoming more common despite being typically associated with infections. For years, not recently acquiring any infections since the 1950s. The trend is out of control, and it is now being called an epidemic. That's how bad it is. Now, what I want you to realize is that we're global now, and we have been global now for a number of years. Since back in the 80s, we became a global society. We travel all over the world, in other words, here, there, and everywhere. Where back in the day, it could have been more contained, at least to the United States, because people weren't going abroad like they go now. We travel abroad just like we travel from state to state. So you're talking more like in the future, days and years to come, another global worldwide epidemic because of our traveling experiences. The National Coalition of STD directors said the country is facing recent chlamydia and syphilis problems. Chlamydia remains the most common reported in the STI in 2022 with 1,649,716 cases. That's a lot of cases, people. In 2022, now you know the data is not all out for 2023. They're a year behind because they have to collect the data and then research it and report it. So the data that will be coming out this year will be for 2023 because we're in 2024. Okay? Within the epidemic, syphilis is one infection that stands alone, according to Dr. Laura Bachman. She's the acting director of the CDC's Division of STD Prevention. So now we have a public health challenge, as if the C-19 wasn't enough of a health challenge. Spread basically the same way. That one was airborne. This one is through sexual contact, still spread by people. You have to come in contact with them, this time sexually. The data is showing a nearly 80% increase in cases between 2018 and 2022, reaching 207,255 more people, the greatest reported since 1950. That's 30, I was 40 years. I was born in 54. Okay? And I'm 70. So there you go. You do the math. There were also, hey Jules, how you doing? There were also more than 37 cases of infants. So it's affecting infants also. And unborn children. The mother is pregnant with the child. And that child will be infected also. If the mother has it, she's going to pass it on to the child. Now, here's what's going on. So if there are also more than 3,700 cases of infants being born with syphilis, the highest number of congenital syphilis cases reported in 1 year since 1994. This is 2024. The data is alarming, and it's showing 937% increase in babies over the past decade. That's almost 1,000%. These numbers are showing a failure in the U.S. health system. The CDC said this. I didn't. Because a testing a month in advance of the pregnant mother having the baby would have solved all of the problems for the newborn baby and the mother. But it wasn't, and it has not been done, and it's not being done. This would prevent all of the infections of the newborn baby. It's very alarming. And I don't think people are even, they're not even concerned about it. Recent data from the U.S. Centers for Disease Control and Prevention shows a grave picture of a growing number of STI cases, especially syphilis, plaguing the nation. A failure of health system. The CDC website announced more than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported here in the United States. This has become a major health crisis. We are more concerned about what's going on in somebody's home, what they look like. And here we got a major health crisis going on all around us. With us as the parents, the grandparents, and everybody else, whoever is sexually active, and it can be transmitted, and unborn babies who are coming into the world. There are significant disparities in reporting the STIs. Almost 50% of reported cases. Billy is saying the devil is working double time to destroy God of the Most High creations. Yes, he is. But also, I think God is sending us all kinds of signs like he has always done in the past, Billy, to bring us together and to stop all this foolishness and all this deceitful things that people are saying and doing. There is no reason for that. You don't know it to be a fact. You're just bothering people when we got major issues out here in the world that are not being solved and could affect every one of our homes. That's what I don't get out here. Almost 50% of reported cases of chlamydia, gonorrhea, and syphilis were among teens and young adults, ages 15 to 24. These are a lot of young men and young women becoming adults now. They're more sexually active at a younger age than ever before. They're having children at a younger age than ever before. But we're not concerned. Not out here on these streets on YouTube. We're not concerned about that. Yeah, have you heard any other content creator come out and talk about it? It's not a concern. It's either coming out in defense of some foolery somebody said about you, or you got some idiot up there trying to bash you. But we got major concerns. And this could be happening to their children right now when you're trying to tear down somebody else. Not all, but most people are blind, don't want to see. I agree, Billy. And that has been since the beginning of times. We see what we want to see. We hear what we want to hear, and we believe what we want to believe. If I come out here and I tell a lie on you, Billy, that lie gonna travel at 100 miles an hour. But if I come out here and say something positive about you and say something nice about you, they didn't hear it because that ain't what they want to hear. People like negativity. Hey, Kevin, good evening. You agreeing? Okay. The racial minority groups, us, black people, disproportionately represented in the data, with 31.1% cases of chlamydia, gonorrhea, and primary and secondary, good evening, Kevin, syphilis occurring were among Hispanic, Black, African Americans, and people, even though we only make up 12.6% of the U.S. population. Hey, Loretta Allen, how you doing? And welcome to Chatting with Ms.V. The disparities reflect differential access to quality sexual health care and differences in sexual network characteristics. Acknowledging the root cause of the inequalities in the system should be ranking higher, but it's not. It's not at all. I see your comment. I'm not reading that. I don't have any mods in here right now. I feel the same way about you because you are off topic, okay? And you should go and you should check in and make sure you get the mental health you need, okay? And I'm going to leave that comment in there, but I will report it to YouTube. Okay, Jules got you. Thank you, Jules, because I can't with these people. You be on a very serious topic, and then they come in with the foolishness. I can't with that. Hey, Kelly, how you doing? You were coming? Okay, no problem. Acknowledging the root cause of the inequalities in the STI rates is a critical first step. You first got to acknowledge that it's happening. It is already, thank you, Jules, it is already being reported. It's happening. It's in the news, but nobody seems to care. Now, I don't have no way I'm going to get pregnant. I'm going to be a rich woman. I'm not even having sex, so that would be kind of unlikely unless God did me like Sarah and blessed me with a child at 70 years old. He blessed her with one at 90. So through him, all things are possible. But unlikely, okay? Because she did have a man. I don't have a man that I'm sexually active with. So that would be nearly impossible. And haven't had in 4 years, despite the lies out here on YouTube. Yeah, I just thought I'd throw that in for the sick people. who keep spreading the same lie because they like lying. I went down a few minutes ago and got on the computer, and I was actually looking for Rhonda the gorgeous one, because she thought she had been blocked over here because I didn't see her comment. But I didn't see her in the block list. So if Rhonda comes in, I got to try to keep an eye on her to let her know she's not on the block list. I don't know why I can't see her. Okay. Had to get a couple of shots, but it will be okay. I pray everyone is doing fine. Okay, Kelly, I'm glad you're doing better. Maturity matters in all instances of the case. It doesn't matter how old you are. You can be a mature 5-year-old or just the opposite. When you work with children, you can even see in children how mature some children are versus others, and they're the same age. I could see it even in my special needs kids. Some were more advanced than others and may have had the same problem, same type of problem. Maturity can come at any age. You don't have to just be grown to be mature. You can be grown in a number, in a physical number, but be very childish on the back end. You see it every day. Old people, grown people calling old people childish or too old for that. But you're too old to be saying that, because you should have something else to talk about. But you don't. But you don't see that as immature. Okay, Kevin, thank you. He's agreeing. So you got to first acknowledge that there is a problem. If you can't acknowledge that there's a problem, you can never solve the root cause of the problem. This stuff is empowering and affecting groups of people out in the general public, in our health community. But it needs to be addressed on a higher level, a systematic level, that there are inequalities in the healthcare system, especially when it comes to minorities. Are we getting the same care or the best of care? Hey, Cheryl P., good evening. That the other people are getting? Are we getting the best medicine? A lot of our medicines are being prescribed as generics. I've had to ask. I don't want that. I want the real thing if I got to take it. Whatever my insurance doesn't pay, I'm willing to pay it. Everybody can't do that. So they got to take whatever they can. Do you realize there are people out here in 2024, elderly people, that's having to make a choice between eating and getting their medication in the United States of America? And they done worked all of their life. We got great concerns out here, people. We got real challenges out here, people, in the world. And it ain't getting no better. Not at all. Please hit the like button when you come in. 3 dots up in the right-hand corner. Tap the screen twice. Thank you. The C19, from what I read, is partially responsible for the rise of the new health epidemic or challenge. Because when we were busy concentrating on trying to find vaccinations and getting people inoculated with the medicine, the virus, or whatever they put into you, they took people out of the healthcare system that was working with this problem. This problem has been around since 2018. Rish the fish, you look like Tammy Roman, auntie. Okay, I'm always looking like somebody. There's a new person I look like. And ain't Debbie Allen today, huh? Okay. I don't know who she is. Okay. Thank you. I guess. Um, so the C-19 is partially responsible for the rise because it shifted the attention away from syphilis prevention and treatment, according to the Chicago Sun-Times. In 2020, 96% of American health departments reassigned the people that were working on the prevention staff, and they reassigned them to the C-19 staff and their related duties, according to a report in the Sexually Transmitted Diseases Journal. This led to major disruptions to tracking, testing, lab work, and intervention efforts related to the STIs. Okay, so if the C-19 lasted 3 years, it's still going on. You and Rhonda, I see you. I went down there and looked, and I don't know why you couldn't comment, because I was just telling them. I went through my block list, and it is a long block list of trolls. But you were not in there, so I'm glad to see that you can comment. Hey, Ms.V, I can't comment now. I pray all is well. Yes, it's well. And for those of you who are just coming in, we're talking about the new epidemic out here now, which is a major health crisis, and it is syphilis and chlamydia and gonorrhea have come back on the scene, which we haven't really had to worry about too much since the 1950s when they came around with the penicillin vaccination. But like everything changes in life, they're going to have to come up with something else a little bit stronger now. The strand is different. It's not the same one that they had back in the 1950s, 60s, 70s, 80s up until now. Transmitted the same way. Okay? The CDC shows that the U.S. faces a rapidly deteriorating public health crisis with lives at stake, according to the National Coalition of the STD directors. They still have not put a staff together like they had when it came down, when they finally admitted that the C-19 was real and not fake, and we got to do something after hundreds of thousands of people fell dead every day. My husband happened to be one of those that got caught up in that after the car wreck and going into the hospital and catching it in the hospital. The fake one. That's what was said out here. I'm a grieving wife behind that still. You don't think I miss him? You're sick if you don't. Do you think I want to hear about him every day, whether it's good or bad? People in my real life don't do that. They know what I went through. Only the hateful people out here on YouTube do that. And they come at you every time you got a crisis in your life. Every time one came for me, I had a death in my family. And I couldn't grieve unless I tuned them completely out and ignored them. And that's what I did. Now, if I'm coming out here telling y'all on my channel and they laying off in the bushes listening, that's an evil person. That person really does hate you because they don't even want you to have peace in your life. They don't want you, but do it to them. I dare you to do it to them. Oh, she evil. She came after me and she know my husband had just died. She came after me and I had just lost my nephew. That's why I can't with these people out here. I cannot. Lord Jesus, prayers to you. Oh, it's been a while. Now it's going on 4 years now. Hmm. Yeah. But it still brings up memories, good and bad. Good memories of the times we had, the travels we took, the life I lived with him, being a housewife for the first time. Bad because he's not here anymore and you are bringing it up. And you won't let him be in peace, and you're trying very hard not for me to have peace, but you can't do it. Because I pray, and that has been what has saved me. When I came out here, it hadn't been very long since he had passed. And I was dealing with it, and nobody out here knew about it. Nobody. Because I hadn't mentioned it. Because I don't talk about a lot of things that trouble me. I came out here smiling and laughing. Thank you, Kevin. Yeah, it still hurts. And it'll hurt a long time. Going through the holidays without him. Holidays were big to him. We were on the road during the holidays going somewhere. Very few holidays did we stay at home during those 10 years that we were actually married. All I can do is look at him and shake my head. Because you're sick. But what goes around comes around. And it's just like Ocean said, everybody's got their day. Your day will come. I'm not going to wish any bad luck or anything like that. Oh, that's my girlfriend. On any of them. Because it's coming. A lot of them are already going through bad luck, demonetized and everything else. And they really need this money. Yeah. But the worst is yet to come on that. Yeah. Because you didn't have to do it. You didn't have to lie. You didn't have to make up anything. You didn't have to do anything you did. You chose to do that because you're evil and you're hateful. So back to this topic. We got another major crisis. Hey, Miss Joy. Hey, Tajisti. Karma is very real. But you see, this is the difference in me and them. I'm a strong ass woman. I never saw him put in the ground because we were going through the pandemic. They only let so many people come. I was out in Las Vegas. How I even found out about it was on Facebook. Facebook put the company he was working for, put it on Facebook before his family had even contacted me. That's how I found out about it. See, that's why I say I'm a strong woman. These people could never go through what I have been through in my life. Never. I don't worry about no health crisis. I don't worry about very few things in life. And I damn sure ain't going to worry about some mentally deranged people who need to be put away and locked up for life. They don't even have a clue how they treated family during the pandemic was cruel. It was. And gave them very little compensation. I can get nothing for my husband passing away with it. And it's on his death certificate. Yeah. But receiving anything, I had lawyers to call me, but I ain't received a darn thing. Not from that. He was going to his job that morning when he had the wreck. Yeah. I had talked to him in the hospital and told him I was going to get out of Las Vegas that Friday. He passed that Thursday evening. He thought he was coming home that Friday. I'm a very strong woman. I am. I could tell you some things I've been through, even worse than that. Hmm. But that's why I don't let anybody out here in YouTube distract me. First of all, you want this page down. You've been wanting it down. You'll never get it. I saw you over there at JP today saying somebody had been bothering you. They're going to always come after the people that don't bother them, because if you're not clicking up with the people that they're clicking up with, they're coming for you. Now, I done figured the whole thing out here on these streets, like I say, but it is what it is. The best thing you can do is not listen to them. I don't listen to them, so it don't bother me. Whenever somebody sends me a clip, I'll be like, oh, they didn't have no commentary today, so I guess it's my day today for you to lie on me today. Hey, Sharon. Yeah, that's just the way it is. We have other issues in the world that are much more concerning issues to each and every one of us. No, I'm not worried about no transmitted disease. Hey, Tanya. But it could happen to some of my family members. I have young nieces, great nieces, and nephews. Little cousins. That's something you don't know. When you hopping off in the bed with somebody, you doing sexual pleasure. You're not thinking about you gonna get up and you might have chlamydia, syphilis, or gonorrhea. That's not in your thought process. But if we got an epidemic out here since 2018, which is steadily getting worse because the federal government is not funding the money that we even need to get the medication you need to get rid of it. So what do? Nothing. Just continue to tear down other people. We ain't concerned. It ain't gonna happen to me. Yeah, but what if it happened to your daughter? Or what if it happened to your son? Don't expect sympathy from people you done tear down now. Don't expect no empathy. Don't expect no condolences. Don't expect no cash apps or no none of that. Because it ain't gonna happen. Because you weren't happy when you were getting them. So don't worry about it now. There was no demand for you to do and say anything. Because nobody did and said nothing to you. There's, in my opinion, an agenda. Oh, definitely. And it could be, since it's worse in the Black community. That's another thing. We out here tearing each other down out here on these streets. Like people that's just stoned to the bone crazy. But you're not thinking about the food shortage that's been talked about out here. Food is high as it is, but then we gonna have a shortage of food? Huh? Is it gonna take all of this for God to pull us back together and make us zip our lips? Gasoline is so high now you can't hardly do nothing but go down the street. I'm thinking about getting a moped. The hell with this. For the little places I gotta go now. People still out here trying to live like they used to live. And you don't realize you ain't making no more money now. You might be making less. People being laid off their jobs. Stores are closing around the whole United States. I looked the other day when I was going to run in the dollar store when I was going to church the other morning to get some mints for up there in the choir. The store is closed. They just opened that store last year. It's real out here, people. It is very real. And for those of you who have not recognized it yet, Like I tell you every day, keep living. Now I got an income coming in. I don't even understand these people who don't have a fixed income coming in. How they can waste time like this out here on these streets. You need to find you something to do. And some with some benefits. Life ain't going to be lifing for you if you just keep on with the foolery. Let me get back up. I see y'all coming in and saying stuff to me. Kelly is saying, preach, Ms. V. Glad I've been closed leg over 3 years. Thank the Lord. It's not necessary, especially for a woman my age. That's not nothing that you sit up and you think about every day. When you get in your 60s, that's why the foolery out here on these streets about what they said about me and that other content creator over there, the younger man. I just shook my head. Because you don't even understand life and how people think and what people are really interested in at certain points in their life. I never had sex again, ever in life. I am good. And you can ask any older person that. That's the lie you wanted to tell. Even though the woman came out and said, look, I apologize. I shouldn't have said it. I lied. She admitted it. It's over on Patricia E. Jackson's page. You're still bringing up that same lie. And that's been 3-4 years ago now, I guess. He never said it. Lele never said it. I never said it. You said it. Get a life. Nobody want to hear that. You couldn't take a lie detector test and pass. Were you in the bed? Were you the cover and the sheets? No, you just a liar. Just admit, I like to lie. Nora, hello. How you doing, Nora? Good evening. Welcome to Chatting with Ms.V. You're saying amen. What the new epidemic rising queen? It is syphilis. It is gonorrhea and it is chlamydia. And it is bad. Because like I said, they took the staffing away, the nursing staffing and the hospital staffing and the people who were doing the research to work with the C-19 virus. And when I guess it was over, they didn't restaff it like it had been, or we wouldn't be having these problems. Now, we ought to be concerned about a global epidemic of it because of how we travel back and forth in and out the country. Like, it's nothing anymore for us to jump up and catch a cruise and go to the Caribbean or catch a flight and go over to see your family in Africa. To Jesse. Canada is bordering the north. It's easy to cross over. It don't cost a lot to go from Niagara, New York, Niagara Falls, New York. We went straight across the bridge, okay, after they checked us out and everything. And we were in Niagara Falls, Canada. Just like that. Looking from one side to the other. Mm-hmm. It's so many problems in the world with so many cruel people living in. Lord, help us all. Oh, he gonna help us all right. He gonna open up some eyes. He gonna reveal a lot of things. This is the year of exposure. A lot of people are gonna be exposed with the truth. This year, it's already been happening all year long. They can't even handle the truth. When the truth comes out, they can't handle it. They will lie about their life. They won't bring you no paperwork saying like I did. Okay, well, here's the marriage license. Here's the death certificate. Here's what he died from. They ain't going to bring you that. And then when you bring it, they'll find something else. They're deflecting off of their lives, but they are not with what the real problems of the world is. It don't matter about you lying on me. That ain't gonna have nothing to do with if you catch this epidemic that's going on now because you are sexually active. So you say you got a man there with you. Do you know if he's stepping out on you? Or are you stepping out on him? Time will tell. I don't have that to worry about. So y'all got a lot of things to worry about. I don't have to worry about. Mm-mm. You cannot make my life miserable. Because we don't believe in the same thing. I believe in a God that lives up above because I done seen the stuff he done did for me in my life and the things he's brought me through. You don't see it or you stop doing what you're doing. But you can't because you don't know him. That's why. They just don't care. This is a money-making operation out here. The latest content creators that came out here is all about money. They want to run up like people who've been out here for years and years, and they think they just gonna run up like them on drama. It's worked for a while, but you see them numbers ceasing now, don't you? See, people get tired of that. Y'all didn't hear me when I told you the first time. People just don't want to hear the same thing all the time. They want you to bring them something new and refreshing. Something that nobody else is talking about. A worldwide epidemic we're about to face. A second one. We just had one. The C-19. Now you're talking about a health crisis. A sexually transmitted disease that could wipe all of us out. And they'll be sitting on them commodes and stuff. Look, don't even put paper on there. Raise your tongue up and do your business. And if you got to sit on, you go on to the house. I don't trust none of it. I don't know how long it stay alive. Do you? That would be horrible. To sit down there and catch something off them toilet seats. Don't do it. I don't care if the paper come around. Raise up. Okay? See, it might look clean, but it might just been wiped. You don't know what's still down there. Like I said, you don't know how long it's alive. Not me. When you get in your 50s, you need to stop. Exactly. They don't understand that older people, that's the furthest thing from their mind. If you've been sexually active all your life, God just decided he was taking my husband on. I told him from jump, I wasn't interested in no another man. For what? He was going to be old. I'm not trying to deal with nobody's health issues right now but my own. If I bring another man in here, he's going to be an older man. I don't want to take care of him. I'm not a nurse. It's enough taking care of me in my old age. And the sex has declined at this age for both of us. You don't see old people doing nothing but sitting around looking at each other. If they liked each other back in the day, they going to show it. If they didn't like each other back in the day, they damn sure going to show it because they don't look like, Lord, I wish she gone up in the house somewhere. And if they together, they ain't talking. The wife is usually one that tries to initiate the conversation. But you listen to what that man is saying and you know he ain't trying to be bothered with her. Ain't nobody stupid. I don't want that. Sure, Ms.V, you're absolutely right. The disease is syphilis, gonorrhea, and chlamydia. Go read about it. Google it. Pull up the new health epidemic of sexually transmitted diseases and go read it for yourself. Okay? I don't know what the end is going to be. He said it wouldn't be water, but fire next time. Now, I always thought that the fire would be just, the whole thing would just burn up. This would be your hell here. When everything just catches fire since you got a new world. This would be the hell here on earth. That's what my mind has always been. You get caught up in the air. Dead rise first. And you get caught up there and you judge. You just fall back down here the way you are, but you just be burning. That's in my mind. I don't know that to be a fact, but I don't want to do that. So therefore, I'm not coming out here lying on nobody. I'm not in nobody's business. because I don't know it, nor do I care. The replacements are slow in coming. Moral accountability is the best defense against STDs. Yeah, what happened to the condom? Hmm? What new STD? Yes. It ain't new, it's old, it's just back again. They've been around since the 50s. They were actually pretty much distinguished or eradicated in the 50s when the penicillin shot came out. But they're back again. And it all came to pass in 2018, just before the pandemic hit. Then they took all the money and put it into that and the cures for that. And that's how the Chicago Sun-Times is saying that this is how it got so bad so quick. See, Queen, this is why I stay single. I'm good. You just have to protect yourself, if for nothing else. Loretta Allen, I'm with you. Say that. Okay. Kevin is saying the same thing. You mean those STDs are back? They are back. Google it. I just told you what to look for. The sexually transmitted diseases are either put new health epidemic of sexually transmitted diseases, and it'll pull up for you. That's how I found it. It came up on my timeline. I have the news and trending news up there. And it came up today, and I was like, oh, wow. And they said this has been going on since 2018. Hey, Coffee. It's going to be the fire. That's what it says, Kevin. The devil was thrown out of Eden to this earth, made stronger due misuse and overuse of antibiotics. Yeah, and the biotics now that they used to give is not doing the job. And the sad part about it was when I was reading about the pregnant mothers who have it, don't know it, get pregnant, and then these babies are coming here with it. And if you're in a certain minority color and don't have the insurance and you're going into the hospital on the government, you're not getting what you need. There is also a shortage of drugs out there in some states now also. I'm happy at my age. I'm through with all that sex stuff. 72 is beautiful on me. I know that's right. Sex disease free. Same here. And you think I'm going to go and run that? Please. Not me. You got me all wrong. I thought you knew me, but you really don't. It's obvious. Okay? The CDC shows data that the U.S. faces a rapidly deteriorating public health crisis with lives at stake, according to the National Coalition of the STD Directors. The STI rates will continue to spiral out of control unless communities are given the federal funding needed to provide the most basic screening, treatment, and prevention services. Beware. Women and babies have had to bear the most devastating consequences of the nation's STI epidemic, with treatment shortages, workforce cuts, and attacks on women's health care. Drug shortages in some states. The reality is that the 2023 data, which will be coming out because we stay a year behind, the 2023 data will be coming out for 2024 real soon. And the reality is that the 2023 data will be worse. If you have not been treating it, if you have not had the proper medication to treat it, and you will start seeing some deaths. Right now, They said the two things that they're seeing is eyes, eye problems, and hearing losses. That's been the main two things that they're seeing with this new epidemic. I'm happy. Okay, I read yours. And Kevin is saying true. Well, that just about takes me to my hour, guys. I am so elated that y'all came over to hear me tonight and chat with me about it. Miss Carolyn, I am just getting ready to get off. I got to go get in that pool because it was too hot to get out there today. And the sun didn't come out, but it was still hot out there. So I'm going to get in the pool. I will see you guys in the morning with a brand new topic. I just searched it in Canada and it says it doubled from 2018 to 2022. So y'all got the same report in Canada that we have here in the United States suggested. It started in 2018, and I think I said that earlier. You might not have been in here, but I said that earlier. But my report was for the United States. I did not go out on a national scale in different countries to see what it was doing. You'll see me in the AM. Okay, Miss Carolyn, please catch the replay for me. But it seems like y'all have the same report that we are having. If it doubled in Canada, it was the same thing here in the United States. Just beware, people. Talk to your younger siblings if you have younger siblings or anybody who's still sexually active, and let them know that it is a new epidemic out here. It is not being talked about, but it's information out there about it. Just like just Google it and pulled it up. You can do the same thing and be aware of what's going on around you. It's not important what's going on in nobody else's life. Not at all. When you have major issues here that we need to face. All right. I'm going to enjoy my swimming. All right. Thank you for coming in. Y'all, please hit the like button for me. And for those of you who came in late, please catch the replay and do your own research on it. Hit that like button, become a member, and subscribe. Thank you very much. And I'll see you good guys tomorrow. Be blessed and have a wonderful night.